Cannabis is legal for medical and recreational purposes. We've got an awesome lineup joining us today, so we're going to go ahead and get right into it, starting with some introductions. Joelle, why don't you tell us who you are and why you're here?
My name is Joelle. I'm a registered nurse. I work in newborn intensive care and postpartum. I've been doing that for about 14 years. I'm also a board member of the People's Harm Reduction Alliance, which is a syringe access program that is run by and for drug users here in Seattle. And I was the director of women's services for that program for 7 years before joining the board. I'm also on the board of directors of the National Perinatal Association, which is an interdisciplinary professional organization that values the voices of parents equally with doctors and nurses and such. So quick intro about what I'm going to talk about. I don't focus exclusively on cannabis because doctors and judges and those people, they don't see a difference between people who use cannabis and people who use heroin. They think of us as all the same, and really, so do I. We're all the same, whether you use cannabis or caffeine or what have you. So, I just want to talk about how parents can face interference from child welfare or even criminal charges for using while parenting. And these effects, like most effects of the drug war, fall primarily on people of color and people in poverty. There's no good evidence of harm to children from any substance use other than alcohol in pregnancy or while parenting. It's difficult to study because designing a study where you randomly assign people to receive a potentially harmful substance is unethical and impossible. However, we do have some good observational studies. However, researchers tend to interpret their data in a way that magnifies or straight up invents risk. They'll say, we didn't find any differences, but that doesn't mean there aren't any. We should still keep looking. It's also difficult to verify which parents are using drugs and which parents aren't, because the ones that we catch are the ones that have maybe chaotic lifestyles, live in poverty, have other poor social determinants of health. So we end up just assuming that all the effects of poverty are the effects of drug use, which is not accurate. So we really need to get better at design. The reluctance to accept that drugs are not the boogeyman is in every aspect of medical research, child protection, law enforcement, policy making. Families are being traumatized and ripped apart for no reason, and that hurts the babies and children that we supposedly are acting on behalf of. And I can skip most of the rest of this. The main result of criminalization is that people avoid seeking medical care, which is the main thing that can actually improve outcomes for everyone, but especially people with substance use in pregnancy. Thank you.
Yeah, hell yes, woman, preach it. I'm really glad to have Joelle here talking about the broader effects, not just of cannabis, but the war on drugs. The war on drugs is a war on drugs, not just a war on cannabis.
War on drug users.
Bingo, exactly. It's a war on you and me. And we're seeing it now, the newest iteration of that, with opiates and pharmaceuticals. And so when you talk about that and how the two go together, you may actually be doing more harm than good in that term. So this really helps broaden our horizons, and that's what cannabis is all about, an open mind, seeing things a different way. So thanks for that perspective, Joelle. So all of these panelists and myself, we know that it's not that big of a leap to go from cannabis to even just say other plant medicines like mushrooms and things like that. But even beyond that, harm reduction policies, reducing, that the harms of prohibition are far greater than the harms of drug use. So can you talk a little bit about how all of us could be a better friend to the broader harm reduction community, and how we can talk about that in ways that those of us that may not know how to do that better?
So that's a lot of what I talked about on my In Between Bands speeches the last couple of days, and I'm going to put those on YouTube. You can look up it's just my name, my YouTube channel. But to touch on a few things briefly, the research data that we have about pregnancy and cannabis, or pregnancy and heroin, or pregnancy and crack cocaine for that matter, the results are all the same. There is no evidence of any serious lasting harm from cocaine, cannabis, heroin, any of that in pregnancy. So one thing that always gets under my skin a little at this festival is the idea that cannabis is better somehow than these other drugs, more natural. I mean, heroin comes from a plant, as does cocaine, as does cannabis. So it's really not a very large leap. We do see a temporary treatable withdrawal syndrome with infants that are exposed to opiates in pregnancy. However, it's temporary, it's treatable, and then the babies are fine and they go home with their parents and they live happily ever after. So this idea that cannabis is somehow different from other illicit substances, it's not based in science, and it's certainly not based in love, and so I challenge that. You know, cannabis is amazing, and it can heal a number of ills, environmental and human, and I don't think any one of us is saying that drugs are qualitatively the same. However, opioids have been healing people's pain for decades. Who wants to go get an operation without opioids? Who wants to have a baby without an epidural? Well, some people. And amphetamines have been helping people with narcolepsy and attention problems. And all drugs have a use. And perhaps some are more widely useful than others. But drugs are inanimate objects, and they don't have a moral hierarchy. And one is not better than the other. It's just useful in different ways. So that's what I'd like to end on. Thank you.